So I'm Ben King, and I'm a Master of Public Policy student at UC Berkeley. Yeah, so I actually found out about the internship while just doing some online research and Googling for positions in the Bay Area. And what was really attractive to me is that I'm super interested in doing public health and healthcare policy oriented research, but I also want to go into medicine. And so it was sort of like a unique combination of being able to engage in public health research while also, having access to the clinical setting, which was great. So it was kind of the perfect fit for me. Sure, yeah. So this summer I worked on a project aimed at identifying sociodemographic and health risk factors within our population of Medi-Cal patients here in the Napa-Solano service area for high healthcare services utilization, both overall and specifically within the emergency department as well. So the basic idea is if there are certain characteristics of patients that we can use to predict who's going to be a high utilizer of healthcare services, especially in costly settings like the ED, maybe we can identify those patients ahead of time and intervene with preventative measures and actually improve care for those patients. During my internship here, I attended, I think 5 or 6 health education classes and sat in on those and just kind of helped orient the patients and check them in. It was really interesting experience for me as someone who's applying to med school and wants to be a physician because as we know, educating patients on healthy behaviors is such a huge part of health in general and promoting health within patients beyond just treatment of disease within the clinic. And so it was really cool to get that perspective of health education and how health promotion works with nutrition and exercise in those behaviors that are really important for people's health outside of the clinic. Yeah, so usually I spend a fair amount of time working independently on projects I'm working on, so doing data analysis and things like that, but you're always going to have some interaction with the physicians and working with the other public health interns. And I think, on many days it's also common that you have some, supplemental educational opportunities, whether it's, sitting in on didactics with the residents or other training sessions or getting to shadow a physician or something like that. So it's a really nice mix of getting to delve into the research and work on those skills, but also being able to mix it up and kind of learn from other folks in the residency program as well. Yeah, so I think the biggest thing was gaining research experience in an applied healthcare setting, because that's actually what I'm interested in doing with my career. Is I want to become a physician and I want to be a clinician, but I also want to stay engaged with research within healthcare settings like a hospital like Kaiser Permanente. And so basically just being able to work on a project that directly informed organizational decision making for Kaiser, and that directly applied to delivery of care to patients. That's like a really important experience for me and kind of like a primer for what I want to do with my career. Yeah, so I had the opportunity to create 2 different posters for two different sides of the same project while I was working here, and then I also had the opportunity to present both to a group of physicians in the residency program here, so attending physicians and residents, and then also our Medi-Cal group here in the Napa-Solano service area at Kaiser Permanente, so the group of people that are involved in making decisions in healthcare delivery for our Medi-Cal patients. So one thing that was really nice about the presentations is being able to present to those two different groups. Really gave me the opportunity to try and figure out, get that experience of how do you tailor this presentation specifically for a group of physicians versus a different presentation that you're trying to center around organizational decision makers and management at Kaiser Permanente. So that was really cool, and it was awesome in general just to get the opportunity to do those presentations, make the posters, and I felt like I learned a lot in the process and actually refined as I went back and forth with Dr. Rabbani and the other students. I kind of refined my understanding of my project and also what conclusions we could draw off of it just based on going through that process of making the presentation. So it was an incredible learning experience. Yeah, so I thought the work experience here was exceptional. Seldom have I worked in an environment where everyone is so friendly and welcoming, and even more importantly, everyone's really eager to put you in positions of learning. So even any random talk by an attending physician that maybe doesn't apply directly to a public health intern, they're happy to invite you in and anything you're interested in. But yeah, I think overall it's one of the more friendly places I've worked, and really great workplace culture, nice balance of still doing rigorous work, but people are friendly and welcoming, so it was really awesome. Yeah, I would say beyond what I had mentioned earlier about just getting that really unique opportunity for me to gain access to the clinical setting while still getting to exercise my research chops that I've been working on building skills through my program. I would say my favorite part and the most fulfilling was working on a project that sort of directly applies to organizational decision making in the policy world, and definitely in academic research. It can really take years for research to take shape, and a lot of times in policy research, you might make recommendations to a policymaker, and it either take years for those recommendations to get implemented, or they don't even get implemented. So for me, I'm an applied-oriented person, it was really rewarding to be working on a project that is going to be applied to improving care for patients right away. I would just highly recommend it to any other students, policy students, MPH students, especially if you're interested in going into medicine or going into other forms of public health research. It was an incredibly rewarding learning experience and just a really pleasant place to work. So yeah, highly recommended.